Okay, you've had your gallbladder out and you're having problems with digestion. Well, most of you have had your gallbladder removed because there were stones in the gallbladder. And you can consider the removal a blessing because it'll keep you on your toes as far as watching your diet. Because most likely the stones were formed because you weren't watching your diet. Stones in the gallbladder are formed because always what the gallbladder does is it stores bile. The liver, this is the liver over here, this is the stomach, this is the pancreas, and this is the duodenum. This here goes to the esophagus and up to the neck. The liver constantly secretes bile, in addition to a whole bunch of other things. Bile ends up going into this sac called the gallbladder. It sits there until the duodenum and stomach get a sense of something called a motor meal. Usually when your food comes down into the esophagus, it mixes in with the acid in the stomach and it gets broken down into liquid. It goes from solid to liquid because of the acid in the stomach. When you have a fatty meal, the stomach lining can sense that and it starts to tell and secrete hormones to stimulate the gallbladder. Gallbladder squeezes, and when the chyme or liquid food enters into the duodenum, which is the first part of the small intestine, it mixes in with the bile that also was squeezed out of the gallbladder to meet and start digestion. The bile is responsible for emulsifying fat. That means it breaks down fat. Kind of like detergent will break down soil on your clothing. Well, bile will emulsify it so that when it enters into the small intestine down here, the little finger-like projections called villi that absorb nutrient, macronutrients, fats, carbohydrates, and proteins, will be able to take the small pieces and put them into the bloodstream through the wall. The problem will come with the tube. If the tube here is blocked by anything, in the Philippines you can actually have parasites that block that tube, but in America you probably won't. You'll have stones. Stones form because of either genetics or an imbalance of the components inside bile. Sometimes you can have stones formed by gall salts. Bile is made of salts, essentially, and sometimes they can come apart. Instead of staying in solution, they'll come apart. Just like a snowflake makes a snowball. So if you do happen to be one of the few people that unfortunately has a gallstone, you'll have a stone here, and stone here, and if the stone is small enough, it'll pass through the lumen, the center of the tube, and it'll pass out the sphincter of Oddi, that hole where the bile gets secreted. Now the problem is if you have a big stone, it ain't going nowhere, so it can't pass through there. So what happens is it kind of blocks the hole and it irritates. That big stone will irritate the lining of the gallbladder, and you'll know because you'll have intense pain in the right upper quadrant, especially when you eat a fatty meal, or within half an hour of eating a fatty meal. The objective is to go through laparoscopic surgery, cut and tie the gallbladder so it doesn't bother you anymore. And this is where that maladaptive or malabsorption occurs, because when you come out of surgery you don't have any gallbladder, so you still secrete bile through the tube, but it comes out at a different speed. So if you have a huge fatty meal, guaranteed, because you're just having the bile trickle through, you're not going to have the amount of bile necessary for your big old fatty meal that's coming through. So that's why it's important to watch. In the first few weeks of surgery, you'll watch the amount of fat you have. But truthfully, it is important always to watch the amount of bad fats that you eat in your diet. You can have good fats. You probably have to kind of pull it back a little bit as far as how much volume you have after you take out your gallbladder. But either way, if you secrete the amount of, or if you have food that doesn't match the amount of bile needed, you're going to have these fatty pieces not get absorbed in the villi of the small intestine. They'll go down to the large intestine. There's a lot of bacteria in the large intestine. So when that gets exposed, to those bacteria get exposed. That's normal flora. That's normal to have that. But sometimes when you have the normal flora exposed to fat that didn't get absorbed or broken down properly, you'll have a lot of gas, because those little bacteria down there will like the fat and they'll have a lot of gas formation. You'll get bloated and it'll hurt like cramps. or it'll make you want to go really fast. So sometimes the objectives are to try to slow down that process, and most people it'll equal itself out after the first couple weeks, but in a very limited few, you'll still have that problem of maladaptation, the urge to go defecate after fatty meals. It's important to see and ask your doctor about what's going on. Believe it or not, the things that will help bind those bile salts are steaming certain vegetables, especially green leafy vegetables, collard greens, broccoli, any of the family that you can get the steamed green leaf into this area after digestion will bind up bile salts, and it'll neutralize it in case you're not eating fatty food. Neutralize it so the bile salts won't get so irritating to the colon. Staying with a mostly whole food plant-based diet, it also, with a lot of fiber, will also slow down the transition of all that dumping or all that fast-moving food bolus. So as we follow the food, when it goes from solid to liquid to out to where it's just waste, if it goes too fast, you'll have irritation, you'll have bloating, you'll have diarrhea, and the urge to go, and cramping. If it goes out nice and slow, during the time period that you're getting used to not having a gallbladder, better for you. So again, I mentioned green leafy vegetables and then fruits. So those are both healthy. Staying with, you certainly have to tone down the amount of fats that you eat in your diet. Everybody should tone down the amount of omega-6 fats or processed fats, and everybody should increase on their omega-3. I usually play with my patients, I'll play a little bit of caution when I suggest taking omega-3 fish oils after the gallbladder is removed. I would wait until they stabilize and take care of either the irritable bowel syndrome or they get more fiber into their diet. And then we kind of reintroduced omega-3 fish oils. So it's all just a matter of living a clean, healthy life, mostly clean and green, and staying away from some of that bad stuff that causes dumping or causes irritation. So you can consider it a pain in the butt. We can also consider it a blessing because you're going to mind your business, and it usually means that when you kind of cut back on crappy food, you'll have less likelihood to go into metabolic syndrome, cholesterol problems, prediabetes, diabetes, and the other things like heart attack and stroke that come after that. So consider it a blessing, but you still have to work for your food. You still have to be planning out your meals, and you have to probably still stick to a mostly whole food plant-based nutrition practice.